You know, artificial intelligence, it has the potential to totally transform our healthcare system. But is it some kind of miracle cure, or is it more like a treatment with really dangerous side effects? Today, we're going to dive into the 2025 watch list report from Canada's drug agency to really understand the incredible promise and the critical perils of AI in Canadian healthcare. Let's get right into it.
Okay, so before we can even start talking about a potential cure, we have to understand the sickness, right? Let's get a really clear diagnosis of the challenges facing Canada's healthcare system right now.
So, get this. Every single year, Canada spends a massive amount of money on healthcare. We're talking 11.3% of our entire gross domestic product. I mean, that is a colossal investment, no matter how you slice it. But what are we actually getting for all that cash? Well, here's the thing. According to a 2023 report by the Commonwealth Fund, that massive spending gets us, and I'm quoting here, modest to poor performance compared to other high-income countries. We're dealing with crazy long wait times, and our healthcare professionals are just drowning in administrative work and burning out. So the bottom line is, we're spending a ton, but we're just not seeing the results we should be. And this brings us to the big question, doesn't it? With our whole system under so much strain, a lot of people are looking to technology for answers. So is artificial intelligence the cure we've all been waiting for? Let's really explore this idea of AI as a kind of prescription for the system. The 2025 watch list points to a few key technologies that could really help treat our system's ailments. We're going to take a look at two of the most promising ones right now. Okay, first up, AI note-taking. Just imagine an AI scribe that listens in on a doctor's conversation with a patient and poof, automatically generates all the clinical notes. This is a total game changer. It frees doctors from being glued to the keyboard, which means more real face-to-face interaction. It slashes all that after-hours paperwork that leads to burnout and could seriously boost job satisfaction for our frontline providers. And hey, this isn't just some theory. In a recent study in Ontario, these AI scribes saved primary care providers an average of 3 hours a week. 3 hours. I mean, just think about what a doctor could do with 3 extra hours. See more patients, maybe do some research, or, just get home to their family on time for once. All right, another huge prescription on the list is AI-powered remote monitoring. This is all about using sensors and wearable tech to collect a patient's health data right from their own home. Then AI algorithms crunch that data in real time, sending alerts to doctors and even predicting health problems before they turn into emergencies. It lets us be proactive with care right where the patient is most comfortable. And the real-world impact? Wow, it's stunning. One Canadian study of a program called Liability found that for patients with chronic heart or lung disease, this kind of monitoring cut down emergency department visits by a staggering 68%. That shows you right there how AI can keep people out of our swamped hospitals and just improve their quality of life. But beyond just efficiency, there's what might be the biggest promise of all, seeing what the human eye might miss. We're talking about using AI to scan medical images and data to spot diseases like cancer or Alzheimer's way earlier and more accurately than we've ever been able to before. But this incredible power, well, this is also where we find the biggest risks. Like any really powerful medicine, AI comes with a big warning label. And the watch list report is super clear on this. If we don't deal with the critical side effects, we could end up doing more harm than good. One person in a workshop for the report just put it perfectly. Garbage in, garbage out. That one little phrase, it gets right to the heart of AI's biggest weakness, the data it learns from. So here's the problem. AI models learn by chewing through massive amounts of old health data. But that data, it reflects decades of our own real-world human biases. So if our past medical practices have, say, underdiagnosed certain conditions in specific groups of people, the AI is going to learn that bias. And it won't just repeat our mistakes, it could actually amplify them, making them bigger and leading to misdiagnoses and making health inequities even worse. And the stakes here are literally life and death. Think about this for a second. An AI could be trained to spot heart attack symptoms from medical records. Awesome, right? But what if those records are mostly based on men's typical symptoms like chest pain? Well, if a woman comes in with what are often called atypical symptoms like nausea or jaw pain, an AI trained on that biased data might completely miss her diagnosis, and that could be a fatal mistake. And this, of course, opens up a whole other can of worms, a really thorny question. When an algorithm is part of a harmful error, who's on the hook for it? Is it the company that built the AI, the hospital that bought the software, or the doctor who trusted its recommendation? Right now, our legal system just doesn't have clear answers.
Part of the problem is something experts call the black box. A lot of these advanced AI systems are so incredibly complex that even the people who made them can't fully explain how they reached a particular conclusion. So, how can we possibly expect a doctor to take responsibility for a decision that was made by a tool whose own reasoning is a complete mystery?
And all these issues, the bias, the liability, they're creating a serious trust gap. A 2024 survey showed that a massive 79% of Canadian doctors are either not confident or just plain unsure about AI's ability to protect patient confidentiality. Think about that. Almost 8 out of 10 doctors. If the folks on the front lines don't trust these tools, getting them widely adopted is going to be a huge, huge challenge.
So, where does that leave us? What's the final prognosis here? We've got this technology with absolutely incredible potential, but at the same time, it's loaded with these profound risks around data, liability, and just plain trust. So, are we actually ready for it?
Well, here's the really chilling part. The consensus from the experts who put this report together was this. These technologies will be added to the system whether the system is ready for them or not. The AI revolution in healthcare. It isn't really a choice, it's an inevitability, being pushed forward by both consumer demand and commercial investment. Change is coming, and it's coming fast.
So, AI is already writing the prescription for the future of healthcare. It promises to cut costs, ease burnout, and give us earlier, better diagnoses. But it also carries that risk of making biases worse and creating all these new complex ethical problems. So the question we're all left with is this: are we, as a society, prepared to fill that prescription?